Before you start using Eligard 7.5 mg, 1 month, subcutaneous syringe, make sure to read the Patient Information Leaflet from your pharmacist. This medication is given by injection under the skin as directed by your doctor, usually once a month. It slowly releases the medication into your blood over a 1-month period. If you are using this medication at home, it's important to learn all preparation and usage instructions from your healthcare professional and the product package. Make sure to remove the product from the refrigerator and allow it to come to room temperature before use. Also, be sure to properly mix the medication and check for particles or discoloration before injecting each dose. It's important to use this medication regularly to get the most benefit from it and to keep track of when to receive the next dose. During the first few weeks of treatment, your hormone levels will actually go up before they go down. This is a normal response to this medication. If you have prostate cancer that has spread to the spine or caused urinary blockage, you may require closer monitoring by your doctor, especially when you first start treatment. Be sure to tell your doctor right away if you have any bone pain, numbness/tingling/weakness of the arms/legs, blood in the urine, painful/difficult urination, unusual weakness, or inability to move. Some common side effects of Eligard 7.5 mg, 1 month, subcutaneous syringe include hot flashes, increased sweating, tiredness, swelling of the ankles/feet, and dizziness. Other possible side effects may include decreased sexual interest/ability, breast tenderness/swelling, and mental/mood changes. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the risks. However, it's important to contact your doctor if you experience any serious side effects such as new or worsening bone pain, easily broken bones, or symptoms of a heart attack or stroke. If you notice any symptoms of a serious allergic reaction, seek medical help immediately. If you experience any other effects not listed, it's important to contact your doctor or pharmacist. Remember, if you're in the US you can report side effects to the FDA, and in Canada, you can report them to Health Canada. Before taking Eligard 7.5 mg, 1 month, subcutaneous syringe, talk to your doctor if you are allergic to it or similar drugs. This medication may contain inactive ingredients that can cause allergic reactions. Make sure to tell your doctor about your medical history, especially if you have diabetes, heart disease, high cholesterol, or mental/mood problems. Eligard may weaken your bones and increase the risk for bone loss if used for a long time. Inform your doctor if you have osteoporosis or any risk factors for osteoporosis, such as long-term alcohol use, smoking, family history of osteoporosis, or certain medications you may be taking. This medication may also affect the heart rhythm, and this risk may be increased if you have certain medical conditions or are taking other drugs that may cause QT prolongation. Low levels of potassium or magnesium in the blood may also increase your risk of QT prolongation. Do not drive or use machinery if this medication makes you dizzy, and limit alcoholic beverages while using Eligard. Inform your doctor about all the products you use before having surgery, including prescription drugs, non-prescription drugs, and herbal products. Ask your doctor for more details if you are a male and concerned about the effects of this medication on fertility. It is important to prevent pregnancy while using Eligard, so discuss using reliable forms of non-hormonal birth control with your doctor. Also, consult your doctor before breastfeeding if you are using this medication. When taking Eligard 7.5 mg, 1 month, subcutaneous syringe, it's important to be aware of any potential drug interactions that could affect how your medications work or increase the risk of serious side effects. This medication may also interfere with certain lab tests, which could lead to false test results. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist, and always inform lab personnel and doctors that you are using this drug. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. If someone has taken too much Eligard 7.5 mg and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical attention by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. It's important not to share this medication with anyone else. During the time you are using this medication, it's necessary to undergo lab and medical tests such as blood testosterone level, PSA blood test, and blood glucose. Make sure to keep all medical and lab appointments and consult your doctor for more information. Be sure to take each dose of Eligard 7.5 mg, 1 month, subcutaneous syringe as prescribed by your doctor. If you happen to miss a dose, consult with your doctor or pharmacist to create a new dosing schedule. Do not take a double dose to make up for a missed one. When storing Eligard 7.5 mg, 1 month, subcutaneous syringe, it's important to keep it in the refrigerator, but make sure not to freeze it. If needed, you can store it at room temperature in the original packaging for up to 8 weeks. Once you mix the medication, be sure to use it right away. And remember to keep all medications away from children and pets. When it comes to getting rid of this product, don't flush it down the toilet or pour it into a drain unless you've been instructed to do so. Instead, properly discard the product when it's expired or you no longer need it. If you're not sure how to do this, it's a good idea to consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.